Hi, I'm Rachel, physical therapist.
I'm Marion, I'm amputee.
What we're going to talk about today is compression with a elastic sock. An elastic sock has compressive properties in a circumferential manner. It does not have, it's not elastic or have any pull or stretch in an axial motion. So compression, this sock is very good. However, after surgery, it can be very painful for people to put on. So what I'm going to do, we're going to pretend like you have a fresh amputation with your incision. So I'm going to open this up as wide as I can, and if you'll put your hand and you hook right there, yes. So we get it over that incision, and then I'm going to wrap it over. Yeah, now you can just pull it above your knee.
Okay.
Just getting it over that incision, that's kind of the hardest part. Okay, and you want to make sure that the tuber grip sock goes above your knee, because the knee is kind of the gateway to allowing the edema to come out of your leg. If you stop it right here, then it really has no way to, it doesn't have a good way to get up through above your knee. So what I'm going to do here is twist it at the bottom, and that's to give it a nice closure down here. And we're going to pull it up again. We're going to back it up over itself. Again, just to kind of give some relief around that incision, so we're not just pulling it up on the incision. Good.
It's nice and comfortable.
Good. What's nice about this sock too is it gets tighter at the distal end where we want it to in order to get it shaped.
Okay.
Okay. All right. Now if you pull that off, I'm going to show you a different.
Okay. And so this would be the next step from the ACE bandage to the tubular sock.
Yes. Very well could be.
Okay.
Okay. Or after the post-surgical dressing comes off, then we'll put this on. So the coffee can trick is a good way to get this tuber grip sock on you without, especially if you have a fresh amputation site where the incision is very painful. What we do is we want to put this tuber grip sock right over the top of a coffee can, and you can actually use a coffee can, or if you work in a hospital, cafeterias will have big cans of vegetables, tomatoes, beans. And what you do is you cut both sides of the coffee can. I put duct tape around here in order to kind of keep the edges smooth, just to ensure safety. Okay, so what we're going to do is you're going to put your leg through the can. Now I'm going to hold here. We're going to put that sock right above your knee, and you just hold it there.
No.
And then I pull down, right over that incision. I twist, and then I help push it off as I go above your leg, and it comes right over that incision with a lot less pain.
Wow. And this can be done by myself.
Correct.
With no help from anybody else once I go home. And
Right.
I'm changing or washing or whatever.
Yes, exactly.
Wonderful.
Okay.
Wonderful.
All right, now if you'll take that off, we're going to
Okay.
go to the next progression.
Okay.
Now we're going to say that you are pretty well healed,
Okay.
no more pain with it, but you're still at the point where you need to have a compression sock. Okay, again, what we're going to do is put it in half, just a regular rubber band in the middle to tighten it up. Okay, and so what this is going to do is it's going to give you an automatic stop where it goes on. Okay, so now you're going to pull that on just like a sock. Good, boom. Okay, and the other half, you back it on yourself. Put it in reverse.
Now, do I need to twist it, or the
No, you
rubber
don't.
band will serve as the little thing down there, right?
Exactly, the rubber band will serve as the closure.
Okay.
So that's closed. You got the compression here. Stays
Wow.
on. It's above your knee.
That's easy.
Yes. And the fit for the compression, you want to be able to have, be able to fit your fingers in there.
Yes.
So that it feels comfortable. It's not too tight, because there is an element that we can squeeze too tightly where then the lymphatic system isn't able to help pull the swelling out, or the fluid within your residual limb.
Those two are very simple and very easy for me to do, especially if I was fresh out of surgery and then going through the healing process. So we have the progression from the ACE bandage to the circular, and then the coffee can, and now the rubber band.
Right.
Will there be another step after this one, or this is pretty much it before we go into the socket of a
This
prospect?
actually could be it. There are professionally made compression socks, or they call them shrinkers.
Mhm.
People can use those. This is an economical alternative, a good economical alternative, where this is something that you can buy off of Amazon.com, buy the box in order to, you just cut a length for yourself and have as many as you need for
Shrinkers as
washing
much
and
as you
wearing.
need.
Correct.
Okay.
Where the shrinkers will be costly if they're a
Right.
prosthetic shop.
But this will do just the same.
Oh, definitely.
Great. Thank you.